Now that we have discussed data forms, data types, and data sources, we are ready to consider public health issues as it relates to these concepts. As a public health practitioner, you must first consider the purpose of your data-related question. Are you planning a public health program? Are you considering an epidemiology investigation? Are you developing a public health policy? It is important to clearly define the questions you are attempting to answer so as to define your data needs. Next, think about the outcomes of interest and any other information related to the question. These will guide your data acquisition or collection, and how to use it. When you are developing your issues statement, there are several questions to ask yourself. First, from an epidemiology and program development standpoint, what is known about the health problem? Who are the populations at highest risk? Do effective interventions exist, and what is the degree of effectiveness? Next, there are questions to ask from a partnership standpoint. Who are your stakeholders and potential partners? Who are the experts that you could work with? Finally, from a data standpoint, what data is already available? What are your data collection options, and what are the most feasible? What are the indicators that you're interested in measuring, and do you have or can you get the data needed to measure them? There are a few flavors of questions that drive your issue statement. They are epidemiologic, which asks, what is the relationship of risk factor X to health condition Y? Intervention, which asks, what is the best approach to decreasing risk factor X? Evaluation, which asks, is program A effective? And policy, which asks, what will be the impact of changing policy Z? Your approach to answering each of these is as distinctive as the question itself, as is the data you would use. Your issue statement should identify the question type that you are pursuing. After contemplating these questions, you can start to develop your issue statement. Your issue statement should be framed as an unbiased question or a hypothesis. You do not already know the answer to this. You are seeking data to answer the question of interest. It should be clear and concise. It should lead to an analysis of root causes, of burden of the public health problem, and, ultimately, should lead to multidisciplinary involvement to strengthen the activity. This means having topic specialists, epidemiologists and evaluators, program managers, etc. There are four main components of an issue statement. First is the background or epidemiologic issue. This should utilize multiple data sources and characterize the problem by person, place, and time. The second element is identifying and answering programmatic questions related to the issue. These questions may be on topics related to intervention, evaluation, evidence, management and available resources, both actual and in kind, related policies. You want to identify questions that are answerable, rely on evidence for the answer, and, if answered, will improve the delivery evaluation of a program or policy. Next, solutions under consideration should be described. Use creative and evidence-based thinking to develop these potential solutions and consider stakeholder involvement. Finally, you should identify the potential outcomes. These include both short-term and long-term outcomes that are anticipated. You should utilize prior experience, background data, and evidence from the literature to determine these outcomes. Also, you should give consideration to the data sources for measurement of the identified outcomes of interest. Let's go through an example issue statement process. First, we describe the background epidemiologic issue, which in this case is related to overweight, obesity among Michigan high school children. 12.1% are overweight, and this is generally increasing over time. 10.7% report physical inactivity, and this is generally not changed over time. 16.7% eat 5 or more servings of fruits and veggies per day, and this is generally decreasing over time. The background can also identify trends as well as subpopulations at highest risk. For example, 12.1% are overweight, and this is generally increasing over time. Prevalence of overweight children is higher among 10th graders, males, minority race, ethnicity, especially African American, and those with poor grades in school. There are several programmatic questions that you would answer in your issue statement to help guide program development. Here are a few examples. What does the evidence from the literature tell us about effective programs for this age group or these health behaviors outcomes? What is the existing infrastructure or resources in place to assist in addressing this issue? What are the available data sources and their validity and utility for evaluating a program to address this issue? Are there model policies for schools that could address this issue? How many schools, students, can we afford to reach? With the programmatic questions answered, now we can consider solutions to the problem of youth obesity in Michigan. First, describe the key stakeholders and how to engage them in your activities. In this case, the key stakeholders might include parents, teachers, coaches, Parks and Recreation, the local public health department, high school children, etc. Now, what solutions will you pursue? Perhaps a mass media campaign or an in-school physical activity program. The basic elements of the activity should be included in your description.